Hello everyone, may I take this opportunity to welcome you back to my channel. I am Professor Silas Odongo and I want to take this chance to welcome you back to my channel, Professor Silas Odongo's Knowledge Hub. And ladies and gentlemen, today I want to talk to you about climate change and health, or health and climate change. Ladies and gentlemen, I want to start by saying that health is an important thing. And I want to say that health is defined differently. But I wanted to look at healthy people and WHO. They both think that health has got to do with the general, social, mental, and physical well-being of a person. And so without good health, people talk about diseases, talk about ailment, talk about illnesses. But then people also know about good health, and they really like good health. So today I want to strike some nexus between climate change and health. And I want to say from the beginning that climate change negatively affects health, affects human health, affects plant health, affects even animals, and it affects even ecosystems' health. So you can imagine human beings, people get sick and people even die from diseases. Animals also get diseases and they die. And plants also wither and plants also die, in quotes. And even the ecosystems. We talk about the ecosystems' health. So we are talking about climate change as a bit detrimental to health generally. But we are also saying that if you look at it in the context of climate change, you would easily say that there is some level by which we can say climate change improves health, particularly what we are calling the co-benefits of climate change, all the health co-benefits of climate change. For example, if we were to respond to climate change by mitigation or adaptation, particularly by bringing in sustainable mitigation, adaptations, or intervening for health, particularly using those approaches, then we would really have gained a lot. So climate change is known for the negativities we are talking about. Look at air and water pollution, for example. So many systems depend on air. Many systems depend on water. The moment there is a problem with air quality or water quality, you know very quickly that we will have negative impacts on humans, negative impacts on animals, and negative impacts on plants and even ecosystems, as it were. So then climate change, particularly what we have been able to speak generally, is that it leads to extreme weather. And this extreme weather will affect health because it affects the physical, the social, and mental well-being of people. Look at the physical health, look at the mental health, look at the social well-being, as it were. So then when we define health as a social, mental, physical phenomenon, then that is what we are talking about. But we know that climate change affects almost everybody's health, particularly, but more specifically, it does affect the elderly, it affects children, it affects people from low-income areas, as it were. It also affects women much more than it does with the men and all that. And it also does affect people with pre-existing health conditions that we are talking about. So you can look at that. So let me take this chance to look at them. So the physical health problems that we are having, which result from climate change. So look, for example, at the heat-related illnesses. We have had heat-related illnesses. We just talked about a lot of heat or increased temperatures, and maybe as a result of climate change. And we're talking about situations whereby today, in many parts of the world, we are having frequent and intensified heat waves. You had heat waves which lead to a lot of risks like heat stroke or even heat exhaustions. We have had, even if you go and look at the various medical reports, we had a lot of instances, particularly in desert areas, in arid and semi-arid areas, where people suffer heat strokes more frequently. Even animals like cows and all that, they suffer from the same, or even heat exhaustion. Look at that. So that a direct physical impact of climate change. Look at the second one could be the respiratory or cardiovascular diseases. We've been talking about that. So health research records a situation where we have the cardiovascular diseases and even respiratory. They are on the increase. And why is this? So we are actually tracing this to, for example, the ground level ozones Look at the particulate matter we're talking about, all the pollen grains. So what are they? So we are able to have chemicals that are as a result of climate change. They accumulate because of those processes we have mentioned before. If we have the particulate matter, the chemical substances that are coming around because of maybe wind that could have pushed them from far away. So you can imagine, look at even pollen grains. We have had issues like that. So what they do is that they worsen air quality or even water quality. So if they affect air quality, they could lead to diseases that we all know. Look at diseases like asthma. Look at diseases like chronic obstructive pulmonary diseases that we think about. Look at even lung cancer, for example. Look at even stroke that are nowadays commonplace everywhere. So we can sometimes trace them to the impact of climate change, even though additional research could be required to be able to prove that it is resulting from that. You can see that. And then look at the infectious diseases that we know, the vector-borne ones. So in the tropics, we have like malaria. So we all know about malaria and what causes it. And then we have the dengue fever. So many of you have been able to know that. The West Nile fever that we're talking about, the virus. And then we have the Lyme diseases. Imagine those. So when they occur, we can trace them to changes that we can quickly associate with climate change. Look at contamination of water. When water is contaminated, what results? We look at the waterborne diseases, and we know quite a lot of those waterborne diseases like cholera, dysentery, typhoid, and all those. So if we consume particularly water that has been contaminated, and what has actually contaminated, maybe those underground ozone substances, or those particulate matter, or even those pollen grains I just been able to mention. And then look at malnutrition and food insecurity. We have situations where the floods that we are having, the drought that we are talking about, are normally devastating crop yields. When they devastate crop yields, we have the low production. We have then we have consequential food shortage. When we have food shortages, you know what's happening. We'll have malnutrition or even undernutrition that we're talking about. Now, whenever we have had these things crippling in, then we are going to be having weak immune systems. When somebody is not well fed, they have this. Even animals, when they're not well fed, or even plants, when they're not well fed, they will technically have the weak immune system. And you know, the outcome of weak immune system will be people now become susceptible to all manner of diseases. And probably that's why nowadays people have a lot of those. Then look at the mental health impact of climate change, for example. So look at that one. Psychologists have been able to conduct various studies, and they're able to a large extent, associate some of the mental cases we have with the climate extremes. Why is this happening? Look at the fact that climate change will always come with distress. Just like we even had COVID-19. During COVID-19, people had a lot of stress. You know where stress could have come from. The thinking that we will have issues, so economy will be shut and all this, came with huge stress that has already been associated with the situations that people are feeling at the moment. So we have those psychological processes like anxiety and stress. Look at anxiety and stress. So we imagine extreme weather, and we become worried that things will be worse. So when we think about the future, it looks bleak. So then we think about situations that we are not able to control ourselves. Look at eco-anxiety, for example. The distress that we have, and even the fear that we have about climate change, particularly the youth. The youth who are still very optimistic about the situation of life. If you were to tell them that something is going to make their future become unpredictable, the way climate change has made things very unpredictable, it even make them not to pursue their future engagements because they will lead to retraction of resources, for example. So look at the displacement of and loss, for example. When people are displaced, ladies and gentlemen, people who are displaced suffer a great deal of anxiety, a great deal of emotional trauma, as it were, because they have lost livelihoods. If you lose livelihood, you will be very worried. You also lose your community. You are used to your community, and now you are losing it because climate change has wiped that area, particularly by flood, or has even caused heat waves, or even volcanic eruptions that could have made you to vacate where you used to live. And even the way of life that you've been able to partake over the years has been altered. Your culture has been altered. And so a number of psychological issues will come. So you will find augmented with the natural, maybe some diseases I've mentioned, it kind of exacerbates the situations that we are having. Look at even the social and systemic impacts of climate change on health, for example. Look at that. Look at the weakened health systems that will come as a result of climate change. It destroys healthcare facilities, for example. We have so many countries where we have been able to report floods, even in East Africa, in Africa, even in Europe, and even in Asia. You will have this. So we have disrupted supply chains, for example. Look at even health supply chain, where we get drugs or the processes that lead to production, and even processes that lead to distribution and even marketing will be interfered with. Look at the power outages that we are having and the consequential impacts. Look at the way it interferes with even the service delivery of health services. So whenever a phenomenon like floods has occurred in a place, it cuts the roads, communication systems. It even leads to increased cost in medical service provision that we can quickly look at. Look at it as resulting from or causing health inequality, for example. Look at inequality. And we have been able to say that climate change affects a great deal of places or people who are vulnerable. It does affect, worsens inequality. It affects the people who live or situations that we call them the low-income, marginalized communities that we are having, because to a large extent they might be lacking the wherewithal or the resources that they can use to adapt. And that's why we are very careful about communicating climate change and how we can adapt or mitigate it, particularly for the sake of communities that are living in developing, least developed world, where systems are very low and coping mechanisms are very much slow and low. Look at economic disruptions that climate change will come with, the loss of resources, which will obviously lead to increased cost and the cost of service delivery, as it was. Look at that. And then we can talk about that. So the situation is not bad, particularly if we were to look at adaptation and mitigations that are very sensitive to health matters. We know, I have been able to say previously that climate change can improve health, but I talked about the co-benefits, the interconnected solutions that come with mitigation or fighting climate change, particularly for health. We look at co-benefits as positive gains that will come as a result of interventions that we put, and they could be very beneficial for health. If we look at resilient mitigations or adaptations that are very sensitive to issues, they can make very significant improvement, particularly to water quality, health quality. So we can target systems that we believe are common, like air quality, water quality. So if we were to target adaptation measures, sustainable measures on there, then we can improve health. We can deal with that. We build very strong resilient systems that will protect people from future climate impacts and threats and all sorts like that. So we are talking about health. Ladies and gentlemen, allow me to just recap what we've been able to talk about today. We talked about climate change and health, and I did explain that health concerns the social, the physical, and the mental state, and it may not be just definable by absence of diseases. As long as the social, the mental, and the physical situation is abnormal, then we begin to think about that. And we are saying that climate change has historically, traditionally been known to negatively affect this. The only way by which we can talk about its positivity is through the health co-benefits. We talked about the various impacts, the physical health impacts, talked about the mental impacts, we talked about the social and systemic impact, and I've been able to talk about the co-benefits or even ways of mitigation that can really support health systems. So don't forget, ladies and gentlemen, to be able to share, to be able to follow, to be able to like, and to be able to subscribe to this channel only on Professor Oriaso Odongo's Knowledge Hub. Welcome for a more interactive session moving forward. Thank you. Good luck.